So today we are going to be talking about Botox and some common misconceptions that people think about Botox. So one of the first kind of misconceptions or questions about Botox is the difference between Botox, which is a neurotoxin that is injected into the muscle, versus filler, which is hyaluronic acid that is injected into fine lines, wrinkles. Botox misconception number one is that Botox is always going to make you look expressionless, you're going to look frozen or fake. That is not always true. Um, People like a different kind of degree of frozenness. Definitely here at Smith Facial Plastics, we approach Botox a little bit more, I would say, on the conservative, natural side. So we still like for you to be able to move your face, make expressions. So we tend to not totally freeze people, especially on their first treatment. We like to be a little bit more conservative, but we want to be able to see your expressions still. So we definitely take that approach with it. Common misconception number two is that Botox is always going to last 4 months in every single patient. Unfortunately, this is not true. We always tell patients that your Botox is going to last anywhere from 3 to 4 months. People metabolize Botox differently. Some people it can even last longer than 4 months, and some people it might not even last that 3 months. It's just kind of all about how your body processes and metabolizes it. Good thing is now there are some other options out there on the market. There are kind of other types of botulinum toxin, such as Daxxify, there's Dysport, and a few others. So if you metabolize one quicker, we will, offer another type to see if that one you might, last a little bit longer. Common misconception three, results are immediate. So this is not true. And it also kind of depends where you're starting out. So there's something that's more as like a preventative Botox rather than like a corrective Botox. Preventative Botox would be for someone who at rest has no fine lines or wrinkles, versus corrective Botox is giving Botox to someone who has at rest fine lines and wrinkles. So if you do start out with fine lines and wrinkles, it's going to take several months for those to smooth out. So don't be discouraged if after 2 weeks you still have fine lines and wrinkles. You just need to kind of be consistent with your Botox treatments to kind of, have those smooth out over time. Botox always takes about 3 to 4-ish days to kick in. So you'll start feeling those muscles weakening, and then it peaks at 2 weeks. So yeah, it just kind of depends what, where you're at in your Botox journey, but it's not going to be an immediate result as far as correction of fine lines and wrinkles. Common misconception four, that Botox is painful. So relatively, Botox is pretty comfortable. We use a pretty small gauge needle, so you might feel that initial poke, maybe a little bit of burning, but for the most part, it's very tolerable, and it's not super painful. It also, depends on your injector, their technique, all that, but for the most part, it's relatively comfortable. So you don't need to have, too much anxiety about coming in for a painful procedure. The more you do it, the more you kind of get used to it as well. Common misconception five, Botox is only for women. This is not true. We treat plenty of men as well as women. Same goal to just kind of, relax those fine lines and wrinkles. Sometimes men and women can be treated, with different dosages. And if, a male wants to, not be, like I said, frozen before, we can make sure that it's, natural looking. And then kind of going on the same line as this, Botox is not always used just for cosmetic reasons. Botox has a lot of therapeutic benefits as well. So we use it in the jaw, we can use it for headaches, migraines, blepharospasms, and just tons of different therapeutic uses as well for Botox. So it's not only for women and it's not only cosmetic. Common misconception number six, Botox migrates. So for the most part, Botox goes where you put it. So immediately after, we might have you not hang upside down for, a few hours. We might not have you run a marathon immediately after or wear a hat. But for the most part, as long as you're not manipulating your forehead, pressing on it, massaging those areas, Botox isn't really gonna migrate. It goes where you want it for the most part. So this is, not something that you really need to worry about a ton. Just kind of get your Botox treatment, kind of live your normal life, but don't massage or wear a tight hat or anything like that. But migration is pretty hard to do with Botox. Common misconception 7. The blebs that you see in your forehead, glabella, or around your crow's feet from Botox are permanent. This is not true. After your Botox treatment, you're gonna kind of notice almost little mosquito-like bites on your skin. These are not permanent. That is just the Botox that was injected. It's gonna be absorbed by your muscle in the next few hours, and they'll go totally back to normal. So don't be afraid of those bumps. They'll just kind of absorb through your skin. Common misconception number 8 is that you should never bruise from Botox. As injectors, we always try to avoid any prominent vessels, vasculature that we can see with our eyes, but unfortunately the face is very vascular. There's so many little blood vessels, veins, all that stuff kind of all throughout the face. Sometimes it's inevitable and you will bruise. It will go away. You still got that normal Botox treatment, so it's nothing to worry about, but unfortunately, sometimes you might have a little bit of bruising after Botox, and that's totally normal. Common misconception number 9 is that Botox is kind of the only treatment that you'll need for any fine lines and wrinkles in your face. Usually Botox we use for fine lines and wrinkles kind of in the forehead, between the brows, around the eyes, and then sometimes, there's different areas in the face that you can use Botox for different reasons, but filler is kind of where the other treatment comes into play as far as fine lines and wrinkles. So you'll meet with a provider and they'll kind of talk you through what treatment you need, whether that's Botox or filler. But it's kind of a common misconception that Botox is, going to treat all of your needs for your face, whereas filler is going to, be a big role in that as well. Last but not least, common misconception number 10 is that you shouldn't be picky about where you go and get your Botox. Here at Smith Facial Plastics, we have 2 double board certified facial plastic surgeons, as well as 2 nurse injectors. I am one of them. And at any Botox treatment, whether you get treated with the doctors or one of us nurses, we always collaborate with the doctors. So at any Botox appointment, for your first appointment, you will meet with both a nurse and a doctor to kind of come up with your treatment plan, see how many units you need specifically, because everyone is different. Just because one person gets a certain amount of units doesn't mean you're gonna get that same amount of units. So here at Smith Facial Plastics, you kind of, you're getting the top providers who know the anatomy, all that good stuff. So you're getting the best care here.